So I think for most of us, we have been dealing with mental health and coping with COVID-19 in very different ways over the last couple of months. But I think for teens, they may have been struggling with this due to some different challenges that are particularly unique to teenagers. So for example, if we think about disruptions in social and peer relationships due to physical distancing, guidelines, possible missing important milestones such as high school graduation or prom, and for some, even navigating the pre-existing mental health diagnosis that they may have already been managing, but this may be an additional stressor due to some of the challenges related to the pandemic. And then, as we know, during this particular developmental time period, that it's common for many teens to express wanting to be more independent. And this oftentimes may lead to some communication challenges and difficulties with parents because they may want to handle things on their own without adult assistance. So I think when we talk about, this particular time period, obviously not every teenager is going to experience difficulties and most are going to be very resilient. But I think particularly during this time period with dealing with the pandemic, that it's a unique opportunity to really enhance resilience among teens. So when we talk about resilience, this is defined as the ability to really adapt in the face of hard times or life difficulties. And obviously life is not perfect. And so part of sort of preparation for adulthood is being able to navigate how to deal with things when they maybe don't go the way that you would like them to go. So these are just a couple of tips that I wanted to talk about in terms of what are some of the ways that you can facilitate resilience among your adolescent or teenager. So the first tip is to really establish connections. And so when we think about the importance of interpersonal relationships, and this can be with friends or peers or even with family members, that is an important part of sort of that social connection is really an important part of resilience and well-being for all of us. And so I think during this time period where there are still some restrictions in terms of physical distancing, is that you do want to make sure that there are ways that your teenager can maintain some connection. So they may not be able to go to the mall or go to the beach and those types of activities right now, but you want to make sure that you encourage them to make use of technology and be able to sort of stay connected. And if there are, sort of some reductions in those physical distancing guidelines, obviously having conversations with your teenagers about sort of safety precautions as they begin to resume maintaining some of those relationships and connections in person. You want to support your teens in being realistic. I think for most teenagers, sort of what we know during this particular developmental period is that they're still developing cognitively, and so trying to help them understand how to navigate stress, for example, and talk about things is really important in terms of having them be optimistic about the current situation and the uncertainty that they may be experiencing. So I think part of this idea of helping them to understand and be realistic is helping them to put things in perspective. And so I think one thing as an adult that's helpful, particularly for teenagers, is when you are able to sort of share your own personal experiences of maybe difficulties that you experienced during your teenage years and how you overcame those challenges. And so I think that might be one helpful way to sort of put things in perspective. Another strategy is being able to provide emotional support. I think, again, this may be a time period where for many teenagers, they may be reluctant to open up and talk to you as a parent. But I think if you can sort of be present and be there when they need to have those conversations and talk, that is really helpful to listen to them and encourage them to talk about their feelings. And that if they are the teenager that maybe isn't as verbal and doesn't want to maybe talk as much, is then you maybe want to encourage them to engage in other activities to be able to express their emotions. So if they like to write or to journal, that may be one activity that may be helpful. For those that are into sort of creative activities, being able to support them in doing that. So painting, writing poetry, or even dance may be some really useful activities in terms of helping them sort of cope emotionally during this particular time period. And then for adolescents or youth from ethnic and racial backgrounds, we know that a lot of research talks about the importance of ethnic identity development. And so I think you can use this time period to really talk about the positive messages about their own culture and heritage, and that these things are particularly helpful in terms of reducing risk for mental health difficulties. And so the research shows that for adolescents from ethnic and racial diverse backgrounds, that when they have a strong sense of identity related to their ethnicity or race, that it is helpful in terms of strengthening their resilience. And so that's another important conversation, especially during this time period where for many youth from diverse backgrounds where they may be witnessing increases in racism and discrimination, is being able to also talk with them about sort of how to handle that and how you may be able to maybe process some of those incidents with them as well. And then just to sort of wrap up with a couple of additional things that might be helpful to think about as you help your child navigate, these mental health difficulties during this COVID pandemic, is that keeping in mind what I talked about earlier about, this is a time period where, most teens are experiencing puberty. And so there may be these hormonal changes. And so, it may be necessary sometimes to consult with your teen's physician, a medical doctor, just to see if there are these mood fluctuation or changes or even diet that may be related to more biological concerns, or even if they're taking medication that sometimes may also disrupt mood. And so I think you want to make sure that you check in with your doctor, particularly if the child is taking medication, to have them monitor, if some of the side effects are causing some additional difficulties for them. Find support groups. And I think, this may be helpful for you as a parent, as well as for your teen. So there are groups that can help you to navigate different mental health challenges, for example. So I know that for kids with ADHD, that there are organizations within different communities where there's a parent group and a teen group. And so teens can talk about what their experience is like, and then parents can be able to talk about what their challenges or experiences are like with the child that has this particular difficulty. So if you go to the National Alliance on Mental Illness, their website, nami.org, they do have some educational and support information related to finding groups in your community. So that may be one helpful resource for you. And then connecting with a mental health therapist might be also necessary. So obviously, depending on the level of difficulties that your teen may be experiencing, it may be more important to get help as opposed to monitoring and using apps as a way to sort of cope short term. But I think for me, I always talk about, just because you seek help from a therapist does not mean that you have a diagnosis or that you are, severely struggling with a mental health challenge. So it may be helpful to talk with someone to help you and your teenager just improve your communication. So that might be another benefit of reaching out for some additional support. And then there is a text messaging access through APA. If your teenager texts APA to 89800, it provides some information via text message related to mental health, as well as some activities that they can be able to help with maybe addressing some of those concerns. So that's another resource that might be helpful. And again, I want to thank APA for partnering with me for this Facebook Live series. This is the website here where you can be able to find some additional information and resources on coping with COVID-19 and parenting. And they also have, some links there that talks about some additional